And good morning, good afternoon, good evening, whenever you're receiving this information. This is your show, Líderes del Futuro. It is on KBBF 89.1 FM in Northern California on Thursdays from 5 p.m. to 7 p.m. And we are also on kbbf.org at the same time. And then we create videos in order to share them on Instagram, Líderes del Futuro, or on our YouTube channel or our podcast by the same name, Líderes del Futuro. And over the last few weeks, we've been having conversations in Spanish mainly because we want to have education for parents on how to work with their youth and the mental health. But today, we decided to do this conversation in English because we want to talk to the youth. And for that reason, I have two therapists from Humanidad Therapy and Education Services. We have Bianca Aviña, who's been supporting us for a while at Humanidad Therapy and Education Services. And then we have therapist Jessica Lueza, who is also at the agency, and they both have a lot of experience working with youth. And with that, I want to welcome both of you once again, this time in English. And today we want to have a conversation about a topic that is sensitive, that could be triggering for people, but that it is essential, especially for the Latinx community with undocumented parents or youth who are undocumented themselves. Due to the recent outcome of the elections, we are noticing that youth are sometimes avoiding going to school or showing symptoms of stomach aches and back pain and so on and so forth, which could tell us that there are symptoms perhaps of depression. And therefore, we want to have this conversation about suicide prevention. So let's start with Bianca. Bianca, thank you for taking the time and being here. Um, Tell us, what do we know? What should we know about? Let's start with depression, right? Like, what are some of the symptoms where we can start noticing changes, maybe that can tell us, you know what, it's time to pay attention to this child?
Mhm. Yeah, I think there are a lot of things that happen in our lives, whether it is school, homeworks, friendship problems, problems with family, the stuff that is going on around, in our country. There's just a lot of things that happen within our community, outside in the bigger community, within our family, within our circle, that does lead us to sometimes feelings like it's too much, like it's too overwhelming, and then sometimes that does fall into depression. And what is depression? Some of those symptoms of depression could be there's no motivation to do anything that maybe normally you would be motivated to do, or no interest in what you normally would be interested in doing. There's lack of energy. Sometimes you sleep too much, you sleep a lot more than usual, or you can't sleep. So your sleep is affected. And your appetite is also affected. Sometimes you don't want to eat at all, you don't get hungry, or you eat too much. You just keep eating and eating, and it's a part of coping with what it is that you're going through. And sometimes there is almost like the numbness. It's not even sadness anymore. It's just a numbness. Like I can't even feel anything. Like I'm just being a couch potato, or I'm just laying down and I really don't even know what I'm. Sometimes there's dissociation where your body is there, but your mind is somewhere else. And then, of course, a symptom of depression is also suicide. Suicide, thoughts of suicide, thoughts of hurting yourself. And at this point, when you do reach the thoughts of suicide, there is the hopelessness, the helplessness, the feeling alone, feeling worthless. So all that falls into depression.
And again, there is period of time in the fall when a lot of people get sad, seasonal affective disorder. And it's just to a certain degree something normal that happens to many individuals. They don't get enough sunlight. Um, the weather is changing. There's so many factors that can affect that. But then there are people who are, going into depression. Can you talk to us, or Jessica for that matter, about how going through depression from time to time is to a certain degree normal.
Yeah, definitely, right? I think what people fail to understand is that all of our emotions are normal, right? I think there's always this expectation of let's be positive, let's be happy, without the understanding that sadness is part of us, anger is part of us, fear is part of us, right? And there's a lot more emotions that we have, but I think that's the biggest issue, right? Where then that leads to us being dismissive of like, oh, no, 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 I can't feel this way, right? I'm supposed to be happy. And so, yeah, it is normal to be depressed sometimes, right? Like maybe we had a big plan that kind of fell through, right? And so that makes us feel sad. And if it was something that we were planning and really looking forward to, it can lead into a depression, right? And so it is a part of us. It's almost like an indicator, right? Like we need extra self care, when these symptoms arise. So learning what emotions we have and how to normalize them is going to be super important so that we can learn to work through these difficult feelings, right? There is no going around it. You actually have to go through it so that you can actually process.
Yeah. Yeah, definitely. It's this idea of we are pushed in this society to pretend that everything is okay. We walk past someone at work, maybe at school, maybe at the mall, and somebody says, "Hey, how are you?" "Oh, I'm good. How are you?" "And I'm good." And people are already walking past each other. And when do we have a space that is healthy where we can express our own emotions, right? We don't create that. Um, and as a result of that, we put on masks, and masks where we just pretend that everything is fine. And so it's important for us to recognize, as you said, that we have certain emotions and certain emotions are normal, and experiencing that is normal, and then working on how to better ourselves. Um, and then the other piece is, as you said, examples of when things maybe don't work out. Your friend moves to another state and now you miss that friend. Or you went to the university and you notice that this is not the right university for you and you want to go back, but you maybe feel guilty that your parents already invested all this money, but now you're isolating. And we could go on to many of these pieces, but Bianca, perhaps can you talk to us about what do we do when we start noticing that a loved one, a family member, a friend, a partner is showing all these different symptoms of depression? Maybe it's not willing to talk about it. Maybe it's not coming to us and letting us know directly. But what should we do?
And I'll start out with noticing that in ourselves. When you do notice that these thoughts or this feeling of like the depression is a lot more frequent, if it does intensify, where it's just a lot more and it's actually happening every day and it's happening all day, every day, and it is affecting your daily routine, where maybe before you were at least able to go to school and get your homework done or um, do your chores at home, but now you can't, you don't have a motivation. It's really affecting your daily routine, it's really affecting your relationships. It feels too overwhelming, and then you might even start to feel it physically, where there might be body pains, and then again the sleep, the appetite. So if you do start to notice all this, and then especially with the suicidal thoughts coming up, then those are signs for you individually to start thinking about, okay, I think it's time for me to ask for help, talk to someone, or find a resource. Now, with our loved ones or someone close to us or friends, a lot of times there are some warning signs that sometimes we might not even become aware, but they are there. So, something to look out for, some things to look out for is maybe your friends start to comment things like then themselves feeling hopeless, helpless, or their sense of worth, something with their self esteem. So just noticing comments like that or bringing up topics like that. Or if they do start to say like they're feeling like they're a burden to their family, to their parents, to friends, it's better if I'm just not around. Comments like that, where you're also noticing that your loved one or the other person also has no motivation. There's probably no interest in doing what they normally would. If all of a sudden they start talking too much about death, maybe they'll be listening to music, or drawing. So more like, just around death. And there might be sometimes there are friends that make indirectly or directly comments about suicide, or they ask if you've ever felt this way. So sometimes those comments will come, or those questions will come. And also noticing behaviors, or anything indicating that they're saying goodbye, writing letters, giving away their belongings that they really cared about. And then sometimes there are risky behaviors also, like they might be not eating themselves. So if you do notice someone close to you that's you're not going to eat, or you haven't been eating, I'm noticing, not taking medications if they do take medications, maybe drinking excessively or trying drugs. Um, just a lot of those signals is what could give us indirectly those signs that my friend or someone I love might be going through it.
And then you have those individuals. So we have people who won't talk about it,
Mhm.
right? And then you have people that come to you and they say, you know, can I tell you a secret? But you promise not to tell anybody, right? And maybe we can throw this one to Jessica, but as a 12-year-old, as a 14-year-old, as a 16-year-old, right? And I mentioned this, and I'll ask Jessica to answer in a second, but we just finished doing a survey of hundreds of Latinx students in Sonoma County. And there is a small group of them who say that they don't trust their teachers, they don't trust their counselors in their high schools, they do not trust their parents. And then you have to wonder, well, who do they have? And sometimes they have another person of their same age who's obviously not trained as a professional on how to work with somebody like that. And so what happens when, again, a 12-year-old or a 16-year-old comes to you and says, hey, I'm tired of my parents fighting all the time, or I'm tired that I'm being bullied all the time because of my weight or my ethnicity or my language skills, whatever the situation is, and nobody seems to care. So I think it would be easier if I wasn't here. What recommendations would you give? First, we'll start with Jessica and then Bianca, to those children who are getting this secret.
Yeah, that's a great question. Um, Specifically with what you said, right? The result of your survey saying that there's lack of trust, that's an opportunity to build and maintain that trust, right? Because yes, there's that fear of like, okay, they're telling me not to tell and they're telling me about, they wanted to take their life, what do I do? But listening to them is going to be really helpful, right? Being in the moment, allowing them to fully express themselves will be extremely helpful because what's happening is that they're letting it out. A lot of what happens when individuals don't speak about what they're going through is that they internalize, right? And so they think that they're helping others by not quote unquote burdening them. But the reality is that they're causing more harm to themselves, right? And so when somebody comes to you, right, that's it's important to hold that space for them to the best of your ability, right? I understand that not everybody's trained, right? But everybody's good at listening. And once, you can sense the shift, right? Where it's like, okay, it sounds like they've fully vented, right? And then you can start inquiring about like, hey, so I'm wondering, right? Like, I hear you're feeling really sad and I'm here for you. Is there anybody else that you trust, right? Is there anybody else that we can talk to? Because that's the goal, right? Encouraging them to also use their voice to advocate for themselves, right? And being a support system with them, right? Like, oh, if you're afraid to tell your mom, I can go with you. Or if you want to talk to your teacher, I can be there with you, right? Because that's what ends up happening, that with some of the symptoms that Bianca described earlier, right? There's that isolation, that sense of feeling alone when they might be surrounded by a bunch of people, right? But there's just that lack of connection. And so when you tell somebody like, I'll be there with you, you know, you don't have to find a solution for them, but you can walk that path with them.
Yeah, thank you for that. And I'll go to Bianca in a second. I just want to add that sometimes when a child hurts themselves, adults all around, whether it's the school or at home, say, but why didn't they come talk to me? And so I think it also has to do with, as adults, are we creating healthy and safe spaces where speaking about your emotions is normal? Bianca.
And I want to also just normalize that sometimes we really are going through really tough stuff, that it just feels like so heavy. It feels like so much that, I mean, sometimes those thoughts do start to creep up of like, maybe it's better if I'm not here living, or this is way too much. I can't deal with it. You know, I'm just gonna. So we start contemplating death. And what would it be like if I was dead? Or what, just start to think, what if I wasn't here? Would my parents even care? So I do want to normalize that sometimes having these thoughts, it's normal to some point. It's okay for us to, you know, play around in our thoughts with what is life, what is death, what happens if I'm going through this? Would it be easier if? So whenever teenagers do come and they do start to talk to me about death, I do want to make sure, are these just thoughts? Are we just like questioning this? Or is there really a plan? Do you really have something that you're
Mhm.
like, yep, this is what I'm going to do? So I do want to normalize that it's okay to have questions. It's okay to find that someone to be able to talk. And I know it's not easy, but we could find that person to just be able to say, you know, I'm having these thoughts and I think I need help. And so to be able to find that person and to talk about the overwhelmed, because a lot of times what I find when teens start to talk to me about this, and even adults, sometimes it's not like they really don't want to live and they want to hurt themselves. Really, what it is this is too much. I don't know how to live with it anymore. And the only way that I'm seeing out is suicide. So I wanted to throw that out there, that it is normal to have these thoughts sometimes. And at what point do we say, okay, this isn't just negative thoughts, it's time for me to find help?
Definitely. And what do you do as a professional yourselves, as therapists? I would like to hear from both of you. What do you do when a child does come and in therapy tells you that they've been thinking about it, that they have a plan, but they don't want you to tell anyone, right? Because when you're with a friend, right, the suggestion here, it sounds like you listen, you empathize, right? And you support that person to talk to an adult if you're children talking to each other so that then the right support can be available. And this is where we remind everybody that in this country, in the United States, we have 988 as the National Suicide Prevention Hotline, or Lifeline, as they call it. 988 via text, via call. Either way, somebody will respond. But you, as professionals, how are you dealing with it when I'm assuming this has happened to you?
Mhm.
Yeah, definitely. So as professionals, we're legally required to report. So we're mandated reporters, right? And so that gets disclosed from the first session, right? When we're doing intake, that's part of our discussion where we're allowed to break confidentiality when it comes to safety, right? So if somebody's in danger, whether it's the individual themselves, or if they're intending on hurting somebody, that's when we're supposed to break that confidentiality. And so when that does show up in the therapy room, part of what happens is that we allow the space, right? Let's walk them through the feelings, what's going on, how long have you been having these feelings, right? Because we're also assessing and asking these questions. And so with that, we want to determine the severity of how they're feeling, right? If there is a plan to go through with it, right, we definitely want to sit there with them and just talk them through their options, right? And so while also informing them that, what, we're going to have to talk to mom and dad, right? And some of us have to report to a supervisor,
Mhm.
right? And so those are some of the things that we do. We create a safety plan, is what it is, right? Of like reminding them almost of like, these are your social supports, these are the things that make you feel good. This is your reason to continue to live.
Yeah. It's about not making long-term decisions about a short-term problem, right? Bianca, how do you approach it?
Yeah, everything that Jessica described is exactly what we do, providing them with that space, deciding, okay, is there a plan? Is this a time where we have to break that confidentiality and talk to someone? Do we just need to talk to parents, or your caregiver, or should we actually go above that and talk to someone else, like professionals, I mean, authorities? So and I want to be very honest, because if you are here listening to this, it's probably because you're going through it and you have questioned what would happen if I do tell a professional this, or maybe you have a friend that's going through
Mhm.
it and you want to help. So I do want to be very honest of, if it does get to the point where it's not enough just to tell mom and dad, then we usually do tell a family member, and with parents involved, we do decide, okay, so maybe we need to go to the hospital, or maybe we do need to call the police. Normally, what has happened in my practice is the team will go with parents, usually voluntarily. I haven't had the experience of them not voluntarily going, but the teens that have gone with parents, they go to the hospital, and at the hospital, they will assess and ask questions, and then they will determine, okay, they're safe to go home with parents, or maybe they should be taken to another place where they will be, under care for a few hours, maybe a few days. But that is usually the next step if they are having serious thoughts.
Definitely. And again, it's the fact that they are willing to tell you as professionals. It's a beautiful thing that they have developed that trust to be able to come up to you and tell you, right? Like, because they know that you will guide them properly, will offer them options. And so that's important. Now, a lot of the time, sadly, in the Latinx community, talking about your emotions and your feelings is not the best of experiences. When you express that you're feeling down, that you're feeling lonely, sometimes your parents will just minimize your emotions, will not create that safe space. And so, how do we support parents to, again, create these safe spaces? Maybe somebody who's listening to this information wants to share the information with parents. Although I want to say we have created a video of this as well in Spanish. So our YouTube channel is Líderes del Futuro. You can check it out there. But how do we support parents when a child is trying to show that they're feeling down, that they are sad, vulnerable? How, what's the best thing that a parent could do?
So my suggestion with that specifically is, like Bianca mentioned earlier, right? We really do have to check on ourselves first, right? Because I believe you also mentioned earlier that sometimes we don't want to talk about the topic, right? Or if we dismiss it, it doesn't exist, right? But that's not the case. And so how do we hold space for our child? That's the biggest question, right? And it is looking internally, right? Where it's like they're coming to you, they're telling you that they need help. And so it's important to listen to your child and to not invalidate what they're feeling, right? Because I think some of the things that I've heard, right, where sometimes these feelings come after maybe a breakup in the teenage years, right? And they're like, oh, it's just a boyfriend, you're gonna get another one, or you have nothing to worry about, you don't have bills to pay, right? And that doesn't help them work through their feelings. It actually invalidates them and makes them uh it reminds them that they can't come to you in the future when they're going through difficult times, right? So learning to hold that space for the child, even if you're uncomfortable, is going to be very important, right? Because that you can use that, right? Of like, wow, I hear you, and I'm really sad that you're feeling this way, right? You can empathize with your child, right? Because it's okay to be vulnerable in front of them. I think there's that sense of like, oh, I can't cry in front of them, I can't show any emotion. But the reality is that you're already doing that when you yell at them,
Mhm.
right? You're taking it out on them. And so that's a form of showing them an emotion, right? Just not like sadness or um, the ones that are more vulnerable. And so learning to hold space. And it's okay if you say like, wow, I didn't expect this. Can we just give me a minute? Let me compose myself a little bit so that I can show up for you. Right. So checking how you're feeling too, it's okay. Right. Because nobody's an expert in this. Right. And so learning to hold that space, I think would be the most valuable tool.
And if I could add, even just outside of having that actual conversation, also just some teens communicate it, like I said earlier, through art or through music. And sometimes that's how they're starting to hint it to parents. And parents just, they usually say, you're going to start with that music. Oh my gosh, that music is so horrible. Or you're drawing this stuff again. So that's already dismissing them. So instead, looking for those signals and getting curious as to, oh, wow, you've been listening to that song a lot. What do you think? Or you've been drawing this. I wonder what it is. So just getting curious. And that will allow that door to open for them to want to come to you and open up about this.
Yeah, healthy communication with our children can be challenging if we didn't do it from the time they were born, right? And a lot of the time we do it when they're 1 and 2 and 3 and 4, and suddenly they go to preschool or elementary school. And what they end up doing is we end up in a situation where they don't feel comfortable coming to us because we haven't been present for them. And so it's really important that we talk about this, that we normalize having conversations with our children. Otherwise, they are not going to feel comfortable coming to us. And then, as Jessica also said, if we dismiss their emotions and their feelings, then they're even less likely to come over and talk with us. So creating those spaces is essential. Um, how can the schools also support the students? Because sometimes you have, right, one teacher, let's say in middle school or high school, and they have 150 students. How do we create healthy spaces in the schools for children to feel comfortable coming to us? Again, 56% of the students in local high schools said, I trust a teacher. But what about the rest, right? How do we create safe spaces for students? I don't know who wants to take this.
I can start. So in schools, I think it's important to also create that safe space, right? Because at the end of the day, everybody has difficulties in their life, right? Whether it's the students or the adults that work there, right? And so having that compassion, right? That the kids spend half of their day at the school and the other half at home, right? So in some way, there has to be some sense of connection with those students, right? And so opening up the floor of like, hey, you know what? Yes, sometimes school gets difficult, right? If you're having difficulties, please come to me. Open up the space, right? Allow them to be vulnerable, right? Because that's also what I hear when I've had experience working at high schools, right? And what the feedback I got from students, from their teachers, was that, they don't feel supported by their teachers because it's like, oh, okay, well, get over it. Life happens. And so that's also dismissing what's happening. And that almost makes them feel alone, right? It's like if I don't have anybody at home, and then now this teacher is telling me that I can't come to them, so who do I go to,
Mhm.
right? And so it's allowing the space to have those hard conversations when they show up, right? Because especially in this time, right? You mentioned earlier, we're going through difficulties with elections, right? But not just that, we're going into the holidays. You know,
Mhm.
the season is changing. And then grief is in the air, right? So there's like those collective feelings too that show up for everybody that maybe we don't realize we're absorbing. And so sometimes that adds on to whatever we're already going through. And so normalizing that in the classroom, right? Like, yeah, it's going to get difficult, but we're here together. You know, if you're struggling to understand this, you know, you need extra time, come talk to me, you know, and that may even be an opportunity where they can take it and be like, okay, well, I can talk to them about my homework, but maybe I can use this opportunity to open up a little bit about what's happening with me, right?
Yeah.
And having that compassion.
Mm.
And if I could add, I think as school staff, as teachers, to be looking for those signs again, the kids will communicate through behaviors at school. So sometimes even that student that's super isolated, that wants to stay off, especially if before they were not too much like that. So noticing those students that do isolate, that don't socialize as much, and even the ones that do act out or like the class clowns, sometimes that's the way for them to cope. So noticing those that do, as they say, act out, and noticing those patterns in their behaviors and checking in with them, just letting them know, not necessarily. A lot of times in schools, I think what happens is they do get punished for the behaviors that they do show, or they get suspended, or they get taken out of class. But really, those are the ones that really need to be checked in with. So if you are noticing those patterns, if you are noticing those behaviors, to do make that time to check in one-on-one, and just getting curious again. Just, I noticed your behavior was this and this. What's going on? Just pointing it out to them.
Yeah. Yeah. And again, there are wonderful teachers out there. I always think of Maestra Emma Zavala at Santa Rosa High School, for those of you in Northern California, an example of somebody who goes above and beyond. Right? I always say she is the teacher, she's the mom, she's the social worker, she's the therapist, she's the everything for a lot of these kids. And even years later, I ran into former students of hers who will still think of her fondly, who may be now in another state, the students, and they still ask about her and how is she doing? And again, they have these amazing memories about, yeah, that time when I did something goofy, but instead of just yelling and kicking me out of the classroom, pulled me aside and said, Mijo, what's going on? Right. And so I know it adds to the labor that teachers are already doing, but if we don't create healthy spaces in our classrooms, that also is problematic. And in our survey, we didn't even ask about administrators because a lot of administrators' number one job, especially assistant principals and sometimes principals, is consequences, consequences, consequences. That is actually within kind of their jobs. And sometimes they take advantage of that, of course, but again, it's about parents, it's about teachers and community members, creating these healthy spaces in the community for our children. And again, to children, it's about creating those healthy relationships with some teachers, with your parents, other community members, and reminding you that if you need to talk and you're really becoming overwhelmed and nobody seems to be paying attention, 988 is the national lifeline where you can text and somebody will get back to you in English and Spanish and other languages. If you call, somebody will be there with you, and again, they'll talk to you at those unique moments in your life. It is important that, again, something that may be feeling like something that is always going to be impossible to overcome, right? Many of us have gone through horrible experiences in our lives, and here we are. And it was because we had somebody that we talked with, whether it was a friend, a family member and somebody else. And the other piece that I was mentioning earlier, again, is this idea of secrets. It's not healthy to have secrets. Please, if you're the one who's feeling down, do not ask your best friend to keep this a secret, right? Dr. Maria Hess, who was a colleague, friend, professor to many of us, she used to say, right, that the best thing we could do to heal is to talk about our problems in healthy spaces. And the more you mention it, the less it has power over you. So it's really, really important for us that you understand that. And so, final comments. Let's start with Bianca. What are your final recommendations to the youth and to the parents out there?
I think for parents, I do just want to say to really take their kids serious when they do bring this up, because sometimes there are comments like they're just asking for attention, or when they are in treatment, sometimes they'll come and say, Bianca, it's already been 5 months and they're still with it. Like, when are they gonna get over this? So I do want to just say first to really take them serious, because if a doctor would come and say they have cancer, then you wouldn't doubt to put them in treatment as long as it needs to happen. But when we do say your child is suicidal, there's hesitation, or sometimes it's hard to believe. But there is also treatment for this, and to be patient with their process. Sometimes it does take some of them it takes longer than it does others. So really take them serious and to be very patient with the process that their child is in. And for the youth, my recommendation would be, like you said, Rafa, to really find that healthy space, safe space to be able to share this with someone. You will find someone that will listen to you, that will help you. And if a friend is telling you, yes, to not keep that secret, I think you would rather have them be mad at you than get a phone call that something happened to them.
Thank you. Jessica.
Yeah, I definitely agree with you, Bianca. It's for the parents, it's very much, learning to hold the space, right? And patience is always the key. It's the hardest thing to do, right? Because we live in a world where urgency is a thing, right? And so learning to be patient is going to be your best friend, right? With this or with any other, with dealing with any other difficult emotion. And so for the youth, I would say, you know, feelings are temporary, right? You just have to learn to ride the wave, right? They're trying to tell you something. They're trying to remind you that maybe something's not feeling so good. And it doesn't mean that it's never going to get better. It just means that in this moment, it's hurting you in some way, and let yourself process, right? It allow yourself to do that, because that the more you learn to navigate your emotions, the more you'll process things a little bit faster, right? But also, you'll learn that they're not so bad, right? And so befriending your emotions is going to be your best friend in that case.
Definitely. And again, as we come to a conclusion on this conversation, um, one of the things that I think is important is self-care. So maybe we can take a couple of minutes here, both of you, and talk to us about what self-care really looks like as opposed to just ignoring or self-medicating. So not sure if Bianca, you want to start with that?
Yeah, and I do want to definitely what you said, what really self-care is, because I know there are a lot of coping skills, of like listen to music, do art, go out for a run, do exercise, like, and those are all great. I do always recommend find something that does help you out, find something that will give you that dopamine and just that, the positive feeling. So definitely go out and look for that. Pay attention to what does work for you. But even more deeper, what self-care is also to become aware of yourself, become aware of your emotions, like Jessica has been saying. What does anger feel like in me? What does sadness feel like in me? And who is Bianca when she's mad or when she's sad or happy? So, really becoming aware of yourself and accepting all the positives as well as the negatives. So some self-care is also I accept when I have suicidal thoughts. I accept when I'm feeling this way. This is how it is for me. So becoming aware of it, noticing, accepting, and going in deeper, being not being afraid to be there with yourself. That is also part of self-care.
Thank you.
Yeah, I absolutely agree with that. Yeah, I think we've normalized self-care as like, oh, let's go get our nails done, let's go get a facial, right? Or let's go to the gym. And like Bianca said, it can be helpful, but that's just kind of covering the symptoms, right? And so you really, really, really have to go within to learn how to navigate these difficult emotions. And with the self-care, right, it doesn't mean that it has to be 24/7, right? It's allowing yourself to take some time to, you can literally put it in your agenda, right? From 8 to 9, from 7 to 8, right? This is my time to reflect. How was I feeling today? What helped me feel better if I wasn't feeling good? Or how can I make sure that I feel good again tomorrow? Right. And so, really sitting down with how you're doing is going to be your best self care.
Definitely. I think that a lot of young individuals have been erroneously taught that self-care means watching two, three, four, five shows one after another, right? Binge watching. There's even a term for it. Or we are just watching stories on Instagram and TikTok for hours and hours. And then it's 11, 12, 1 in the morning, and we cannot fall asleep because all those emotions that we have refused to process throughout the day are there. And because we cannot sleep, we go back to picking up the cell phone, the tablet, whatever it is, and we go at it until we're so exhausted, right? But doing exactly what you all suggested is actually self care, not medicating, as I like to call it. And so it's important. And I want to thank you both for taking the time, bringing your expertise to this conversation. You've had the experiences of working with people who are, in different stages of their lives. And so I want to thank you both. And I look forward to our next conversation. Bianca Aviña, therapist in Sonoma County, and Jessica Lueza, also therapist in Sonoma County. Both are working with Humanidad Therapy and Education Services. And for our community, I know that this is a difficult time of the year. And so Humanidad Therapy and Education Services is right now, and we are putting this video audio out there at the beginning of November, but we are preparing to do convivencias, which are opportunities that would be as closely as possible to group therapy, but from a cultural perspective of the Latinx community. And so if you're interested, please reach out 707-525-1515, 707-525-1515. There will be some with a special emphasis in supporting the undocumented community in Sonoma County. Thank you to both of you for taking the time.